Hi, it's Adrian from Dental Artistry. I'd like to talk today about root canal treatment. I know that when people hear the term root canal, I suppose there's a lot of fear that actually comes up because root canal treatment is fairly major treatment. It's really the last ditch effort to actually save a tooth. When a tooth has a lot of decay or, for example, breaks or there's trauma to the tooth and the nerve is damaged, meaning that either bacteria has got into the tooth and caused the nerve to die through to very deep decay, or maybe a tooth has been knocked and the tooth has actually died, what actually happens is generally an abscess will form within the tooth. And an abscess means that bacteria is starting to multiply inside a tooth. When this occurs, there's only two options for the tooth. Is either the tooth needs to be removed via an extraction and the tooth is lost, or if there's enough crown left on the tooth and the tooth is still a viable tooth, is that root canal treatment can be done to drill inside the tooth and to actually remove the decay and the bacteria that is actually living inside the roots of the teeth. When we do this treatment, there's normally a couple of visits that need to be done. One is to actually drain the infection out of the tooth and to place antibiotic dressings inside the tooth. The tooth is generally left for a period of time for all the bacteria to actually die, and then a second visit is actually done to place a filling inside the root canal. If root canal treatment is not done and the bacteria is left inside the tooth, the biggest problem we're going to have is an abscess. An abscess is when the bacteria multiplies so far that it actually causes an infection at the end of the root. For one, it's very, very painful because naturally this is an infection inside the jaw, but secondly, it's very dangerous because now the infection is in part of the body and it can spread. The other side of root canal treatment that's very important is what happens to the tooth after root canal. Well, we consider root canal treatment a dead tooth, and all dead teeth tend to get brittle. If we have a tooth that's actually dead and brittle and it's one of your back teeth, either your premolar or your molar teeth, and it's a tooth that we do a lot of chewing on, the risk is that the tooth can fracture. We have no nerve in the tooth, there's no sensation in the tooth, and the tooth is slightly more brittle, and we start loading on a tooth that has had a large restoration on, we normally find that a tooth can fracture or break. So all root canal treated teeth generally are completed with a porcelain crown to strengthen the tooth. So when we're talking about root canal treatment, there's kind of two phases. One is removal of the infection and finishing off the root canal treatment, and secondly, it's strengthening the tooth to ensure that it doesn't fracture or break in the future.